Good morning. Assalamu alaikum. Peace be to you. This is Omar Abdul Malik, physician assistant and health educator. So, today I shall talk about one of my professions, physician assistant, because according to U.S. News and World Report, physician assistant is the #1 job in the country and in healthcare. Thank God, alhamdulillah. So I have been a PA for 20 years. Well, actually, this will be my 21st year if you count. I graduated from Howard's PA program back in 2000. It's been a great 20 years. I can't tell you what a blessing and a privilege it's been. I've gotten to help myself with my knowledge. Hey there, how are you doing? And help my family and my community. And support my family financially. So, I'd invite those people who are interested in becoming physician assistants. You can subscribe to my channel or just research it. There's plenty of very good YouTube channels out there on the PA profession, much better organized than mine. But good morning. Hey there, how are you? It takes some years to become a PA. Certainly not as long as a doctor. You got to have a 4-year degree. I would suggest some kind of allied health degree, like nursing or maybe respiratory therapy, because that way you can simultaneously get in your prerequisites, because you got to take a lot of science, basic biology, chemistry, organic chemistry, physics, what else, anatomy, physiology, like a fundamentals of biochemistry for most programs, I would say. And of course your college math. You don't need calculus, but just like pre-cal, and your English and literature. But you can, if you do the allied health bachelor's in something, you'll be able to simultaneously get your direct patient contact hours. That's important, because a lot of programs want you to have as many as 2,000 hours, and that's like almost a full-time job. You can do something like biology and become a nursing assistant or phlebotomist in about 6 weeks. You get your hours that way. That's what I did. I got a degree in biology, and I worked as a nursing assistant for a while, for like 8 years. And then after getting my degree in biology and of course graduated from Howard's program, I did University of Nebraska's Masters of Physician Assistant Studies program. I did that while I was working, so it was a distance learning option, DLO, which is also a good option if you're able to take some prerequisites there. So that's pretty much, you got to take the GREs. For those of you guys that are what I call the new generation of pre-PA students, you'll probably have to take something called the PCATs, which is, it's like a standardized entrance exam, analogous to the MCATs for medical school, or the PCATs for pharmacy school. And that's more in tune with what you're going to be studying. So I think that's better than the GREs. That after you finish PA school, you take your PANCE, Physician Assistant National Certification Exam. And then bam! Get your job, God willing, inshallah. And make that nice salary that the Bureau of Labor Statistics, good morning, likes to tout. I think average salary is like $112,000, and you can expect to make that at least $100,000 your first year out of school, which ain't bad, especially if you are a very young person. Like if you're in your mid-20s and you're making $100,000 a year, you, you don't have to live with your parents, which young people want to get away. My kids are in college now, some of them, and they say, look, you guys can stay with us for a while. I go, wow. As soon as we finish school, we're out and get that first job. So they're already looking at apartments, which is good. Yeah, well, my wife and I'll have life as empty nesters. Maybe in less than 10 years, we'll see how the youngest one does. But that's it. Things I've done as a physician assistant is, I've been a clinical coordinator, a research coordinator for clinical trial studies. I've taught, so I was an adjunct professor or instructor. I've spoken on behalf of pharmaceutical companies. Yes, Big Pharma. Big Pharma's not all evil. I coded a lady yesterday whose heart stopped, and we pumped her with a bunch of epinephrine and pharmaceuticals, kept her alive along with the shocking and the chest compressions. So Big Pharma does save lives also. Which need I forget? This is my second week after my COVID-19 vaccine by Moderna, and I feel pretty good. Look at it. Just ran up this super steep hill, and I'm on mile 7 of my run. I had to cut it short because I got to go to work. But that's it about PA. Look at the Bureau of Labor and Statistics, and also look at U.S. News and World Report. If you want more information on it, you can go to the website. Hey there, good morning. For the American Academy of Physician Assistants. And then also look at your local, your state physician assistants, legislative bodies like your District of Columbia Physician Assistant Association, or Texas or Florida, wherever you are, and then they can help. They may be a valuable resource for you, at least as far as try not to get hit. They could be a resource for you as far as getting learning more about the PA or getting your foot in the door. And I'm going to set up some shadowing also for those of you guys that live in the DC, Maryland, or Virginia area. Okay, that's all for now. I wish you guys the best of success in your positive endeavors. We're in the 3rd decade of the new millennium, according to the Gregorian calendar. It's pretty amazing. We've been through a lot of changes, but we'll get through the hard times and thrive and get ready for more hard times. That's the cycle of life. Okay, guys, peace.